and welcome to Medical Dialogue Journal Club, your daily dose of health and medical news. I am Dr. BP Rahul and I am going to talk about the concept of time to target range in the field of hypertension management. Hypertension is one of the most common comorbidities and risk factors for cardiovascular disease, including heart failure. However, standard BP control matrix may not reflect the variability of BP over time. Recently, researchers have proposed the concept of time in target range in the field of hypertension management. The study was published in the Journal of American College of Cardiology. Utilizing this tool, Chang et al. In the post-hoc analysis of TOPCAT and BEST trials have shown that time in target range independently predicts major adverse cardiovascular events in hypertensive patients with heart failure with both preserved and reduced ejection fractions. Time in target range can incorporate both average and BP value prevailing during long-term follow-up and the degree of BP variability. Also, it can account for variation both within and outside the target range. The present study aimed to assess the value of adopting time in BP target range by exploring its association with clinical outcomes among hypertensive patients with heart failure. Seated office BP was measured by trained staff during each visit with the mean number of visits per subject of 11, range 2 to 16 for TOPCAT and 13, range 2 to 18 for the BEST trial. Time in target range for each patient was calculated using linear interpolation across the study period with the target range of systolic BP between 120 and 130 mmHg. The post-hoc analyses have shown that hypertensive heart failure patients higher time in target range with a systolic BP target of 120 to 130 mmHg was associated with lower risk of cardiovascular death or heart failure hospitalization. This observation was consistent across all important clinical outcomes considered among the heart failure patients. The results also held for the SBP target of 110 to 130 mmHg and diastolic BP target of 70 to 80 mmHg. Meanwhile, a linear relationship was found between time in target therapy and the primary outcome, which suggested that longer time in target range is associated with better outcomes. This study explored the value of time in target range with heart failure patients for BP control and found a significant association with cardiovascular death or heart failure hospitalization among the population with a relatively low time in target range. Our study emphasized the importance of monitoring BP in everyday clinical practice and maintaining the consistency of the BP control over time, noted the authors. Efforts to lower the cardiovascular risk among these patients should be taken by attaining a high time in target range for multiple measurements of BP in usual care or via self-monitoring. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.